Acid reflux treatment with exercise is a really exciting new medical management strategy for managing reflux symptoms such as heartburn. Now, this is a really cost-effective, free to do, simple exercise. It's easy to do at home, and what's more, some gastroenterologists are now recommending it to their patients because it's been shown effective in some of the recent research for managing reflux symptoms. So I was really excited to share this to you today. Hi, my name's Michelle. I'm a physiotherapist, and as a fellow reflux sufferer, I really am very excited about bringing this exercise to you so that you know how to do it at home. And just in terms of the recent research endorsing this as the potential for managing reflux symptoms. What we're going to be doing is going, first of all, step by step through how to do this particular exercise. Then I'll talk to you about when to do it. And then I'll talk to you about how many exercises you need to do to decrease your reflux symptoms. After that, I'll briefly mention an exercise that you might be inadvertently doing now that can actually increase reflux symptoms. So stay with me for that. I'll talk to you about that at the end. So let's go through this first exercise and how to do it. This is called a diaphragmatic breathing exercise for reflux symptoms. What diaphragmatic breathing involves is breathing deeper than normal and breathing into the diaphragm. Now, just before we start to go through this exercise step by step, I'd just like to mention that you're probably already aware that reflux occurs when gastric acid rises from the stomach up the food pipe or back up the food pipe where it doesn't belong into the esophagus. Now, these particular exercises have been shown to decrease that movement of the acid from the stomach back up the food pipe. That's the way they work. There's a number of positions you can do the exercises in. You can either start them doing them in either sitting, lying down or standing. Now, I'm going to do the exercise in sitting today because it's really easy for me to demonstrate to you. And also too, we sit to eat, so it seems a very functional exercise, a very functional position for me to teach you to do this exercise in. The second thing you need to do is to address your posture. So if you're slumped forward like this, either sitting or standing, you're likely to increase your reflux just from that act of slumping forward and putting pressure on your stomach up through the esophagus. So what you need to do before you do the exercise and to help you to do this deep breathing exercise is to sit, lengthen the spine by lifting the crown of the head towards the ceiling, and relax your shoulders back and down. You can raise your sternum just slightly as well. So that's your posture you start your exercise. If you're sitting like me, you might like to move away from the back of the chair. I think if you sit in the chair, you're probably inclined to slump a bit, so try to move away from the back of the chair as well. Now, hand placement is what is necessary, the third step, for this particular exercise, for learning this exercise. What I'd like you to do at home is to take one hand and place it on your chest here. Take the other hand and place it on your upper belly, so above your belly button or your navel, but below the bones you can feel in your rib cage so that it's sitting there on your upper belly. Now, I'd like you to take a couple of normal breaths, if you can, and feel the movement underneath your hands. Just a normal breath, just feel what happens, hopefully breathing in through your nose if you can, and relax. Let the air out. And again, just another breath. And out. What movement did you feel under your hands as you breathed in? My guess is you probably felt an outward movement of the top hand, perhaps an outward movement of the bottom hand, but both hands were possibly moving. Now, with deep breathing, it's a little bit different. What we actually do is we try to breathe into the lower hand. So it's a slower, deeper breath using the diaphragm muscle, the muscle below the lungs, to actually fill up the lungs more. As they fill up like a balloon and expand, they force the abdominal wall outwards. So what we do with this breath is we breathe slower and deeper. If you can in through the nose, don't worry if you can't. So let's breathe in at home for 1, 2, 3, 4, breathing into your hand. Now let the air go slowly. Just let it deflate, let the lungs deflate, the air escape passively, you don't need to force it out. That lower hand should have moved out and in. That's what you should feel with a diaphragmatic breath. This top hand should feel still. There should be no movement in the chest and the shoulders. Let's try that one more time so that you've really got the hang of it. So top hand stays still, As you breathe in, this hand here is going to move forward. Posture nice and tall. Here we go. Breathing in 1, 2, 3, 4. Let the air go. 1, 2, 3, 4. And relax. How did you go that time? Did you manage to actually get that strategy going? Another way you can do that, if you're not sure about it, is looking in a mirror as well, if you don't want to use your hands. But obviously you start practicing that particular technique, the way I've showed you, in any one of the positions that we talked about. And when you've actually got the hang of it, then you can actually start to do the exercise after eating. So when do you do the exercise? In the research that's been done to date, exercises were performed immediately after eating. So the Ong study and also too Hammond and others have found that doing these exercises, even standing upright, decreased reflux symptoms such as heartburn when the exercises were done immediately after eating 3 times a day. Now, I'll also add to that you might also too like to do some of the exercises, some of the breathing exercises prior to starting eating. I actually think that is a helpful reminder to start relaxing your belly. If you can maybe do 5 or 10 slow deep breaths before you start eating, and even being mindful of the pattern of your tummy as you are eating. Now, I've already said that you can do the exercises for 3 times a day, but how many exercises do we need to do and for how long? Well, this is an area of contention. The research hasn't fully established the optimum number of exercises to do. In the Ong study, participants actually performed 5 minutes of deep breathing exercises immediately after they'd finished eating, or 30 deep breaths. In the other study, participants actually performed 15 minutes of deep breathing exercises immediately after eating. And Hammond actually suggests, the gastroenterologist actually suggests to his patients to increase up to 30 minutes at a time of deep breathing exercises. So you can see there's some variability in the number of exercises that are being recommended. My personal feeling is you start with what feels comfortable with you and gradually build up and see what works for you. I will also add a word of caution here that sometimes a lot of deep breathing exercises can make you feel a little bit lightheaded or even prone to hyperventilating. So if you get lightheaded, stop the exercises straight away until you're fully recovered, and just work at doing the deep breathing exercises, the diaphragmatic breathing that feels comfortable for your body, and gradually work up the number of exercises you're doing after eating. I'll also too mention doing the exercises when you feel stressed. So you might find that when you feel stressed or anxious, you tend to hold your tummy in. That's another really nice time, I think, to actually practice doing these diaphragmatic breathing exercises to reduce your reflux symptoms. Now, at the start, I mentioned an exercise that you might be doing inadvertently that might be increasing reflux. Now, Ong found that doing a really strong abdominal in-draw increased reflux, so it increased the backflow of gastric acid up the esophagus and increased reflux symptoms. Now, I think many of us, and I found this with patients, that many people inadvertently draw their upper abdominal muscles in without realising it. Now, this can happen when we're tense and anxious. It can also happen if you're a shallow upper chest breather. It can happen if you're someone who holds your tummy in habitually, or perhaps even if you're trying to brace your tummy firmly, maybe even the hope of projecting your back. So I'm talking about a really strong abdominal in-draw here, not just a comfortable core brace. So if you are doing that, it's worth trying to do your diaphragmatic breathing exercises to actually become aware of you doing it and actually stop doing that pattern of breathing and that pattern of abdominal holding to decrease your reflux symptoms too. And if you'd like me to go through that technique in another video, let me know in the comments below and I'll do that too. So you can see we've gone through quite a lot there, haven't we, in terms of acid reflux treatment. We've talked about that positions or various positions to do your deep breathing exercises. We've also talked about how often to do them, 3 times a day, and how many exercises to do when you're ready to start them. So If these exercises, I'd really love to hear how these exercises go for you at home, whether or not they work. Can you let me know in the comments below? It'd be really interesting to find out. And also too, you might like to stay with me for some additional evidence-based reflux exercises. They're coming up in the next video. As always, I'd like to thank you very much for your time today. Really look forward to seeing you in the next video. Goodbye for now.